So all these questions have been great so far. I'm really, really excited to answer these for you, and hopefully that you're getting something out of it as well. Feel free to always put anything in the chat box that you have. And again, if something that I say triggers a question, then all the better. A lot of these have been related around COVID too, which again is super important that we're talking about it. Don't forget the other services as well. I can kind of relay those. But the next question is Healthy Workplace just helping businesses handle COVID? Oh, perfect. This is what I wanted to kind of bring up as well. So no, we don't only do COVID, although the funding for this opportunity through the SBDC did come from the CARES Act. So while everything's very important right now to stay compliant with COVID and helping small businesses, the flip side of Healthy Workplace and what these services can help with is going to be employee wellness, which is one side, and the other is occupational safety and health. So while they're all related to keep employees well and safe and healthy throughout this time, you know, the focus right now is kind of getting through everything to make sure you're healthy. And the next step, obviously, is to have kind of employee health. So that would be virtual programming if you're working, you know, working from home or working remotely. It could be any kind of wellness employee initiative that you might have on site, but kind of having that wellness committee in place is something that I can help with, and policies related to employee health too, like tobacco cessation, you know, nutrition, physical activity, that kind of thing. And then occupational safety and health is going to be anything related to OSHA standards and regulations and making sure we're compliant with that. Having a safety committee in place so you get that workers' compensation discount. So it's kind of everything, but if you really think about it, it's how can I have the most healthy and safe employees that I can. Great questions. All right, I think we're caught up right now in the chat box. Does anybody have any other questions? Again, feel free to come and go as you please. We are going to be here for until 1, so feel free to jump in and out, or if you think of anything as you're working, completely fine.
I'm sorry, Marla. Do we have a schedule for the next and the topic for the next one for Ask the Consultant?
I'll let Rich jump in to see if anything's currently on the calendar, but the next one is definitely going to be a business related topic rather than healthy workplace. But Rich, do you have any insider information on that?
Yes, thanks for asking that, Brian. And probably we will also talk about technology commercialization. That's another Center of Excellence program that we recently started. So probably the beginning of the next year, we will talk about technology commercialization.
Thank you.
But also we will talk about social media, taxes, or business registration, those kind of things as well.
Thank you, sir.
Rich, you're muted right now.
We've wanted to give this a try. So this today is kind of our first step. So we wanted to see how it went today. And I see that there's a number of people, you know, on the call. We wanted to get a couple of these done, kind of see the momentum and the response that we get. And then based on that, make a determination at the SBDC as to how frequently we would want, you know, we would want to do these. But the whole idea is to give, you know, the small business an opportunity in the busy, crazy day of their lives to just be able to come in and, you know, ask questions. And if it gets beyond answering like a simple question, then of course, you guys can become a client of the SBDC at no cost, because our consultancy is all provided by the Small Business Administration. Or a simple question answered might send you on your way and you're helped. And we, you know, believe that that's caused a value added benefit to occur between both us and you. So we're going to see how this goes. So this was our first one today. So, and again, I'd appreciate your, you know, your feedback as well as to how you think something like this would play within the small business community.
We got another question too, which is good, moving right along, is that what OSHA standards do small businesses need to know? So like I mentioned, occupational safety and health is another component to healthy workplace. And so kind of a misconception that maybe small business owners might have is that OSHA standards maybe only apply to manufacturing, factory, kind of large businesses. Well, this is very helpful for these businesses and probably where OSHA originated. All businesses, regardless of size and industry, do still have some OSHA standards that they do need to comply with. So the main one is going to be the general duty clause. So as an employer, you have the responsibility to provide a safe and hazard-free work site for all of your employees. Now, of course, this is going to range depending on what kind of industry you're in. Like I mentioned, the factory manufacturing versus retail, insurance, those kinds of things. But required posters are going to have to be in place, letting employees know what their rights are under the OSHA Act, and making sure that they can report an unsafe incident or physical something on site without fear of retaliation. So that required poster has to be there. Record keeping. So employers that have 11 or more employees have to keep certain injury and illness reporting records through OSHA. If you have 10 or less employees, you don't technically have to have all the required records for injury and illness. However, if you have, a hospitalization or an amputation or something that leads in death, that would require certain record keeping as well. So there's kind of that 10 employee or 11 or more employee number in place for some of the record keeping for small businesses. And that is also the same with an emergency action plan. So you need to have a plan that's written, if you have that 11 plus or more numbers physically written, kept on site to have employees know what to do in an emergency situation. So that could be fire prevention, blizzard, floods, things like that, emergency action planning. 10 or less, that would be still emergency action plan in place, but it can be done verbally. So as long as all of your employees know what to do, for a fire drill or something like that, that would still constitute staying to an OSHA standard. And then the last one would be the employee training. So everybody still has to have all of the employee proper training from an OSHA standpoint about the safety hazards of their immediate job. So still a couple, but maybe not as quite as some of those, larger businesses. If there's any specific questions about any of those kind of standards that I just mentioned, I know I went on a little bit long on that question, feel free to reach out to me directly and I can help you navigate each and every one of those different standards.
Did I understand that this is supported by the Small Business Association Administration? I'm sorry.
Yes, we're the Duquesne Small Business Development Center. So we're specifically helping small businesses with a lot of these things that maybe they don't know about or don't have those resources for.
Thank you.
You're welcome.
So as I said earlier, always the larger businesses have had the luxury of being able to implement industrial healthcare type services, prevention. And I always felt that the small businesses were drastically, behind the caboose when it came to that, because again, they can't afford the large consultancy fees and all of that. Small Business Administration, especially with the unfortunate onset of COVID, came to the conclusion that this would be a wonderful kind of service to have industrial level type healthcare programs available to small businesses. That's why they are supporting and fully funding our Healthy Workplace initiative. So we're hoping that small businesses will take advantage of it and actually have Marla come in and actually work with them as well.
Thanks.
Thanks for those of you who asked questions. Some more people are joining on since this is the come and go kind of session. I see a couple more people coming. We're here to answer any questions that you have related to public workplace. So if this is anything about employee wellness programs, occupational safety and health, any policies or procedures.
Marla, it's hard to hear you or understand you.
Try talking to my speaker a little bit more.
It's all garbled, Marla.
Garbles.
Garbled.
Maybe
Like you're
Marla,
gargling water and talking.
Marla, maybe you could try to, unless Tunja wants to weigh in, maybe you could leave the meeting and come back. I was worried that, something like this might happen, but
I'll get you later.
And also, Marla, you can try to mute yourself and then unmute yourself again. See if it helps.
Do I sound any better now? Or do I need to try to leave the meeting?
No. Yeah. Let's try to rejoining again. Again, just to remind you, we are here until 1 and we're answering your questions about healthy workplace, COVID-19, the pandemic, employee health, wellness, and healthy workplace programs. So feel free to ask your questions. If you have any questions, type them in chat.
All right, I came back on. The other option
You're
I
good,
could
Marla.
do.
Yeah.
Oh, good. Was
Yeah,
I
very
garbled
good.
the whole time from the beginning?
no, just the
No,
last
no.
couple minutes.
Okay, good. You at least got some of the things that I was saying. Good. All right, let me pull up the chat box again. Okay, so since I left the meeting, it cleared out my chat box, but if anybody has any questions, feel free to put those in there again so I can see them. Happy to answer anything. I think Tunja, when I left, kind of told you again, reiterated what some of the questions we're doing, but anybody have any questions I can help with?
I have no questions, but I did want to thank you very much for this. My group works in the hospitals, AHN system, whatever, and they're pretty much dictating what our policies are. So we're just following them.
Yes, so especially
It's pretty comprehensive.
yeah, with healthcare too, there's even a very different side of some of these regulations as well. So when you're talking about healthcare versus non-healthcare, making sure that all the proper procedures are in place for those is important. So thank you so much for your time today as well and answering
pleasure.
some of those questions. I wish you the best of luck with everything.
Oh, thank you. Maybe
Yeah.
I'll see you next time.
Yes.
Okay, bye.
Bye-bye. And just a reminder again to everybody else, we are here until 1. So again, come and go as you please. We've had some people join us from the beginning. Some great questions already have been discussed so far. If you did just join us, again, happy to reiterate anything. Again, any questions that you have, this is the time to share them. There's no being late or early. We're all here for the duration, just a question answer kind of panel session. Just real quick, my name is Marla Breitbarth. I'm the business consultant for Healthy Workplace. So that covers wellness, it covers occupational safety and health, anything related to COVID. We also have Rich on the line, who's the director of the Small Business Development Center, and a couple people from our marketing team. But if you're looking for any of those questions, feel free to type them in the chat box. And I'll do my best to answer them. If I don't know the answer to one of these questions, I'm not afraid to say so. Of course, I don't know everything, but I will certainly get back to you with some of those regulations or standards that I can look into you. If it's specific about your business and you have a question that you don't want to type in here in the chat box for all the others to see, then please reach out to me directly. More than happy to answer those questions with the SBDC at Duquesne. Then we'll just make sure that, we're a partnership and a client, and we can get you all the resources that you're looking for. I'm actually going to type my contact information in the chat box too, just in case anybody does want to follow up afterwards. Oops. I got to send it to everybody. Hold on. There we go. All right. So a couple questions came in. So next question is, what is the most recent safety info for air ventilation? So while looking at your ventilation systems is part of a on-site checklist from the CDC, and also in addition to the air ventilation too, if you had a prolonged shutdown from your building, they also recommend you check the water supply. For the air ventilation, there is a lot of development right now from some of those technology commercial or companies, excuse me, to kind of really look at what's the best way to either have a UV light treatment or not. As far as the current recommendations, I would not be able to give you a very specific answer more than it is something that they are requiring. I should say the CDC are providing guidelines about. So I can certainly look into that information about what the recently or most updated information that they can provide you with specific specifications. But unfortunately, off the top of my head, I do not know what those technology companies are currently doing. If anybody or if Rich on here or Tunja knows, then they can jump in. But that is something I would look into a little bit more.
As of right now, from a technology commercialization perspective, I mean, we don't have any clients immediately that are specifically addressing, air filtration as specifically it might coincide with COVID standards.
Thank you for that question. Next one that came in is that some of the clients of the SBDC ask that it has been hard to connect with employees working remotely. What are some ways that they can still be engaged virtually? So this is great right now because of course everybody can probably figure out that employee wellness and health should be a top priority. But what that usually looks like is having a wellness committee on site or some kind of wellness program. So while people are virtual and they're remote, how can you possibly have any kind of an employee wellness or employee engagement activities done virtually? And while hopefully, the emailing is still being checked while working at home, you don't want to try and overwhelm too many employees with those email blasts because that's kind of the easiest way to do things. So the biggest thing for employees to stay engaged while they are working remotely is to make sure that the communication channel is completely clear. So if there's no communication back and forth, this can really lead to uncertainty, stress, work at home burnout. People don't know what's going on. And having kind of that virtual appearance really does lead to, like I mentioned, kind of the remote or work at home burnout as well. So some great ways to kind of combat this would be having any kind of internal communication system, whether this be a wellness newsletter that gets sent out, anything for any reminders for employees to actually unplug as well. If it's a social hour that you can do online, great. But think of different ways that you can actually get away from the virtual world for a little bit. If that's going to be a physical challenge, maybe that's something that you can implement. But it is going to be important to try and figure out creative ways to do this, because again, the last thing that you want to do is just kind of making that the workday never stops. Implementing some flex time policies would be a nice example as well of something that you can do to kind of help with a few of those stressors and maybe even some childcare as well. Yeah. Again, thank you for everyone who's been asking questions so far. Hopefully you're getting something out of my answers, and I'm more than happy to keep these coming. Just a reminder again, we're going to be here until 1 o'clock. So if you need to jump on or off, then feel free to do so. All right. Another question too. So actually we covered a lot about COVID so far, and I just started talking about wellness. So we have a question now about safety committee applications. So the process seems difficult and there are a lot of requirements to meet for the implementation. Is this something that you can help with? So I briefly mentioned workers' compensation, and what a safety committee is kind of in reference to workers' compensation. So while every employee is required to have the workers' compensation, it can be expensive. And one way to kind of combat that insurance premium is going to be starting and keeping a safety committee. So of course, the PA Bureau of Workers' Compensation kind of makes the application process a little bit difficult because you are getting a premium discount at that 5%. So the application is going to be a little bit daunting if this is the first time that you're filling it out. So I'm more than happy to help you through that process. We're going to take it step by step because actually implementing a safety committee should be done, you know, not half-heartedly. So if you're going to have a buy-in from leadership for the safety committee, you know, this helps everybody, it helps the bottom line, it keeps employees safe, then really you want to do the process right, and I'm absolutely here for you.
And again, we can provide those services to you if you choose to become a client here with the SBDC. As Marla indicated, we can help you do all of that: policy development, policy implementation, committee structure, all of those kinds of things.
All right. Great conversations so far, everyone. I just want to thank you so much again for joining us today. We still have plenty of time, so I'm here to answer any questions you have. We covered a few different areas, so if you're just joining us, I see we have still a few people with us today, some still from the very beginning, so if I'm repeating myself, apologies. But since people can come and go, please answer any, I'm here to answer any questions that you might have. Again, healthy workplace with anything related to COVID, policies, procedures, questions that you can have upcoming, anything related to employee health wellness, again, program implementation, yours isn't doing so well, how can we help? Safety, whether this is starting the safety committee, like I just mentioned with that question, if it's anything related to OSHA standards, compliance, that kind of thing. So let me know any questions that you might have.
Also too, Marla, I know you mentioned earlier, but just to reiterate again, the whole notion of healthy, the whole notion of how do programs and challenges that can be put into place to get your employees on a healthier track and lifestyle, correct?
Correct, absolutely. So one thing I did want to mention, I know a question didn't come up, but this one's a little bit more time sensitive towards the end of the year. So something related to COVID, that is the family and sick time paid leave. So this is the Coronavirus Family and Paid Leave Act. This is still in effect until December 31st of this year. I've been looking back and forth to see if there has been any kind of information shared or an announcement made to see if that is going to be extended. So if that's something that you're unfamiliar with, it's if an employee does get sick from having COVID, they actually test positive. They are entitled up to some paid time off. So it depends if they're full-time, if they're part-time, and what does that look like. So if you're unfamiliar with that family paid leave time, the coronavirus, it's a federal kind of stimulus, then just know that it is effective until the 31st of the end of the year. But we're always looking back to see if there's more updated information. So again, feel free to keep typing questions. The other thing I'm going to mention as well, kind of while everybody's still listening, or maybe you're composing your thoughts, is that while this was directed more to question and answer, if you're looking for more information about healthy workplace, tomorrow we are actually doing a webinar. I should say I'm doing a webinar about all the different topics of healthy workplace and kind of diving deeper into it. So some of these questions, or some of the answers I should say that I'm giving, are going to be covered as well into the webinar. So again, this is tomorrow. It's going to be at 10 a.m. I'm doing the webinar, so you'll hear from me again. And if you're looking to register, it is completely free. And it's going to be about an hour. So we have some time for questions afterwards as well. But all you have to do is going to go on to the Duquesne SBDC website, and you'll see a section that has our workshops. And so you're going to look at the calendar. Once you do that, and also it's probably on the homepage since it is coming up tomorrow, just look for that. And all you have to do is click register. Again, it's free. It's at 10 a.m. tomorrow. And again, I'm going to be covering some of the answers that I shared today, but this is for anybody to jump on and join. It's not going to be the back and forth. So we're waiting for questions to be answered. And I go through a whole presentation. And so it's going to be about the employee wellness. It's going to be about occupational safety and health. And of course, the COVID standards right now related to Pennsylvania and small businesses. So again, there's going to be time tomorrow as well for questions after the presentation. Like I mentioned, it should be about an hour, but I'm hoping to have a big turnout. So hopefully you can come and join as well. But we still have 20 minutes here, so don't go anywhere if you still have questions, because I still want to answer those questions in 20 minutes. All right, so I see that we have 2 attendees still on, again, here for the next while. So if anybody has those specific questions, I know we have somebody on here from the very beginning. So thank you so much for holding out with us. Hopefully you've learned a lot today, and will join us as well tomorrow. But we got Brian and Alejandro, if you're there as well, and you have any questions, now's the perfect time to ask them. All right, I'll wait a little bit longer in case you guys are typing into the chat box. But again, we don't have too many more attendees on this call. So Brian or Alejandro, if you have anything, right now is going to be the best time to do it. That way we're not just sitting on this call for the next so many minutes, but I'm here to give you one more opportunity to ask anything you like. And then we'll probably wait a little bit longer in case anybody else joins, but might be shutting it down pretty soon. Great, well, thank you so much for that feedback. Yep, if you have any questions, again, I'm gonna type my contact information one more time into the chat box. If you do have a specific question, just email me and we can certainly work from there. Again, tomorrow, hopefully to hear from you as well, but I'm just typing my email right now. Making sure I spelled it right, hold on. Perfect. There we go. Shoot me an email if you do have any specific questions. Brian, if you're good too, then that's kind of our presentation for today. We stayed on, we had a lot of really great discussion. Like I said, shoot me an email, see you tomorrow. And Junja, any last comments?
Thank you, Marla. Thank you. It's been very helpful, I guess, for all the small businesses. And again, we will have another upcoming Ask a Consultant session, just beginning of next year. And our focus probably will be technology commercialization.
Thank you, everyone, for participating in our first Ask the Consultants program, which I hope, based on feedback based on level of interest, we'll be able to continue. If this proves to be successful, in addition to our centers of excellence, as of today, healthy workplace and technology commercialization in robotics, healthcare, and life sciences, we hope to also be able to do this for any general business consulting needs. So again, thank you all very much.